All right, let's jump right in. For ever, when we've talked about community safety, what's the first thing that comes to mind? Probably policing, right? But what if that's, well, only half the story? We're going to dig into a really fundamental shift that's happening right where law enforcement and public health meet, and believe me, it's changing everything.
In this quote, this one really nails it. It's from the Global Law Enforcement and Public Health Association. Societies are only as safe as they are healthy, and they are only as healthy as they are safe. It's this idea that crime and well-being, they're basically two sides of the same coin. And look, this isn't just some feel-good saying. It's actually the bedrock for a whole new way of thinking about how we build safer communities all around the world.
So that begs a pretty big question, right? If safety and health are so connected, why on earth have we treated them like two totally separate things for so long? To really get where this new idea is going, we've got to first understand what was broken. And that's this huge wall between the world of policing and the world of public health.
Yeah, and keeping them separate led to what experts call a recurrent failure. I mean, think about it. You've got police focused only on crime, and you've got health services focused only on wellness. They're both missing the bigger picture, the messy, complex reality of people's lives. And this approach, working in these little silos, it didn't just fail to help. The source material is pretty clear on this. Sometimes it actually made things worse.
Okay, so this is where everything starts to change. The solution. It all begins with looking at one single super important word in a completely new way. And that word is vulnerability. You can think of it as the new lens that brings the whole picture into sharp focus.
And this is so important. This new way of thinking says vulnerability is not a character flaw. It's not a personal weakness. Instead, it's a state, a condition that's created by the world around a person. Their environment, the systems they have to deal with, the inequalities they might face. It completely flips the script. It's not about asking what's wrong with you. It's about asking what has happened to you.
And to really wrap our heads around this, we have to see that vulnerability isn't just one thing. It's complex. It shows up in at least 4 different ways. You've got structural vulnerability, think poverty or discrimination. Then there's situational, like a sudden mental health crisis. Then there's systemic vulnerability, and this one is a big deal. It's when the very systems designed to help you are actually making things worse. And finally, and this is so critical, it's intersectional. That's how things like race, gender, and age can all overlap to create totally unique disadvantages.
And here it is. This is the big aha moment. Let's put it side by side. The old way, the deficit model, would look at someone and the question was always, what's wrong with them? And that leads straight to blame, to punishment. The new way, the systems model, looks at that exact same person and asks a totally different question, what has happened to this person? And that simple change, it shifts the focus to understanding the harm, to addressing the root causes. We're not just talking about changing a few words here. This is a completely revolutionary way of seeing the problem.
Okay, so this new lens is a powerful idea, for sure. But how does it actually work in the real world? Well, it's being put into practice across 5 key areas, 5 domains of action.
So here's the roadmap for making it all happen. You've got population-focused interventions, prevention and early intervention, technology and ethics, systems and partnerships, and finally, organizational health and global perspectives. It's a whole framework, so let's break them down one by one.
First up, focusing on specific groups of people. So instead of some one-size-fits-all response from the police, this is all about creating coordinated teams. Let's say you have a situation with a homeless person who's having a mental health crisis. The old way? That might just end in an arrest. The new way brings police, health workers, and social services to the table to work together. They can actually address the complex mix of problems that person is dealing with.
Next, we move from being reactive to being proactive. It's all about prevention. We know from tons of research that there's a huge link between tough childhood experiences, things like neglect or abuse, and ending up in the justice system later on. So instead of just waiting for a crime to happen, this approach says, let's get in there early. Let's support at-risk kids and families to break that cycle of harm before it even gets a chance to start.
Domain 3 is all about technology, data, and ethics. Look, police departments are using things like AI and big data to predict where crime might happen. That sounds great, but there's a massive risk, right? If the data you feed the AI is already biased, then the AI is just going to amplify that bias and end up targeting communities that are already marginalized. So this part is about putting up some ethical guardrails, making sure we use these powerful new tools to build trust, not make inequality even worse.
All right, number 4 gets into what you could call the plumbing of the system.
It's one thing for a police chief and a hospital director to have a nice meeting and agree to work together, but for this to stick, for it to work long-term, you've got to change the actual structures. We're talking about rewriting policies, changing how things get funded, and shifting the whole culture so that working together isn't some special project, it's just the normal way you do business.
And last but not least, Domain 5 zooms out to a global view. You have to understand, this isn't just an idea for one city or one country. It's a worldwide movement. These same principles are being used for everything from supporting the mental health of frontline officers all the way to coordinating responses for climate disasters. The goal is to build a global network where everyone can share what's working, learning from each other across totally different cultures and situations.
Okay, so you might be thinking, this all sounds great in theory, but does it actually work? And the answer is a big, resounding yes. This isn't just academic talk. It's happening right now, on the ground, with some pretty incredible results.
Just take a look at these case studies from around the globe. In Mozambique, you've got police using rights-based approaches to protect the health of sex workers, not just arrest them. In Australia, there are coordinated programs that give victims of trafficking real support, not just punishment. And in Liberia, they're using social protection to reduce the risks faced by sexual minorities. I mean, these aren't just small tweaks. These are real-world changes that are saving lives.
So when you pull all this together, what does it all mean for the future of safety? It really boils down to 4 key principles.
This is really the bottom line. It's a future built on prevention over just reacting to crises. It's built on partnership over working alone in isolated silos. It's about inclusion, making sure the people who've lived through these experiences have a voice instead of being excluded. And maybe most importantly, it's about putting health over punishment. Which brings us all the way back to the beginning and leaves us with this huge question. Could a health-first approach actually be the future of community safety? It's a question that really forces you to rethink everything you thought you knew about crime, justice, and what it takes to build a community where people don't just survive, but can actually thrive.